Hi, an evaluation of Paget's work. So Paget's strengths of his work were that his studies were cross-cultural and conducted studies with different ethnicities, which shows similar results. Also, all children progress through its 4 stages in similar ways. Paget believed that children's ability to understand objects such as shaking a rattle was a cognitive skill that develops slowly as the child matures and interacts with the environment. However, psychologists today think that Paget's work was incorrect. Researchers have found that even young children can understand objects and how they work before they experience those objects. And this was thought by Billigen in 1987. Paget's methodology has had criticism in the area of development psychology. One concern is the limited sample size used in his studies, which was focused on children from the upper middle class European backgrounds. This raises questions about the generalisation of Paget's findings to children from diverse cultural and socio-economic backgrounds. Critics argue from his lack of diversity in participants may have influenced the universality of Paget's stages of cognitive therapy and development. Evaluation of Watson and Skinner. So Watson and Skinner are greatly known in the field of behaviourism. Watson is known for the father of behaviourism, and he's championed the idea that psychology should focus on the idea that psychology should be focused on observable behaviours. And however, it is dismissed the importance of internal mental states. The Little Albert experiment demonstrated how emotions should be conditioned and was ethically controversial. Skinner built on Watson's foundation and introduced operant conditioning. He emphasised the role of reinforcement and punishment in shaping our behaviours. The Skinner box allowed controlled experiments that revealed the consequences which influence actions. Skinner's work has positive influences on educational therapy. Despite their critics, their work is continuing to influence contemporary psychology. Contemporary issues in cognitive psychology. So CBT is a cognitive behavioural therapy which can help with learning and development. It focuses on changing the way we think and encourages more positive ways of thinking when suffering from anxiety and depression. Training programs can help to address any issues such as productivity and performance in the workplace. It also helps with underlying mental health conditions. The strengths is that it's a strong structure, short term, and you can build up a confidence with the relationship with your mentor. There's adaptations in mental health. Weaknesses, it cannot treat all mental health conditions such as schizophrenia. It also requires a lot of work and dedication, commitment, and not everyone suits this approach. So we've found that the strengths in cognitive psychology focuses on mental processes, which provides valuable insights on how we think, remember and solve problems. It has practical applications, which has led to effective treatments for mental disorders like anxiety and depression. However, it shows weaknesses as it relies on mental states which can be difficult to measure objectively. Therefore, it can oversimplify complex cognitive processes. Looking at behavioural psychology, it focuses on an observable behaviour which makes it easier to study and measure. However, unlike cognitive, it ignores the mental processes and neglects the thoughts, feelings and beliefs. Thank you.